at you, it seems like you've got nice pink, good skin tone from head to toe. There's not any cyanosis or blue areas. Evenly distributed hair on your chest, arms, and legs. Back's nice and pink too, so if you don't mind, I'm just going to kind of touch your arms and your chest. It's nice and smooth. Everything feels good. If you don't mind, hold your hands up for me, and I'm just going to check your skin turgor by pulling up a little bit, and if it rebounds back pretty quickly. Very good, so you're nice and hydrated. Alright, you do have a few little brown macules on your chest and your back, and they're flat, not raised. So those are probably just from sun exposure. I'm going to take a look at your hands. Fingernails are neatly trimmed, and the nail beds are pink, and toenails look neatly trimmed. Those look really good. They are a little thick and rigid. Okay, if you don't mind, I'm going to run my hands through your hair. You have nice brown hair. It's soft. Throughout the scalp, there's no balding areas. The scalp is dry, but there's no flakiness or lesions that I've noted. Everything feels pretty good. The skull's hard. There's no soft spots. Okay? And your face is symmetrical on both sides. If you don't mind, smile for me. Okay? And then blow your cheeks out for me. Alright, everything moves symmetrically. Your face is nice and pink. Lift your brows for me. They both move together nicely. Okay, good. So next I'm going to examine your neck. And if you don't mind, I'm going to get you to kind of do this right here. Yep, there you go. Okay, everything looks good. And next, if you don't mind, we're going to test the sternocleidomastoid muscle. And I'm going to press right here, and I want you to resist me. Do this right here. Okay, good. All right, you can release now. All right, so that's nice and strong. The next thing I'm going to do is I'm just looking at your trachea, and it is midline, and I just saw you swallow. Good. And I'm going to kind of just palpate along the trachea. All right, it is midline all the way down. And then next, I'm going to feel for your thyroid. And it's about right there. And if you don't mind, I'm just going to put my hands on either side of it, and if you'll swallow again. Good. Okay, so the thyroid's not enlarged. It seems to be normal, and there's no jugular venous distension that I'm seeing on either side. Next, I am going to listen to your carotid artery. I'm going to just do one side at a time so I can make sure not to put too much pressure and fluid. And I'm going to look for bruits. We don't want to hear any bruits. So I'm going to use the bell of my stethoscope and listen. Okay, so no bruits or thrills. And I'm going to come up to this side. Alright, good. So those are normal. Alright, so everything appears to be normal with your neck. And no, like I said, no jugular venous distension. The next thing I'm going to do is I'm just going to place both of my hands on either side of your jaw. And we're going to test for temporomandibular joint crepitus, which just means that if you open and close your mouth, you know, sometimes you'll hear people's jaws kind of clench or it makes a sound. So I'm just going to see if I feel any of that friction that may be in there. Alright, open your mouth for me. So I don't hear anything and I don't feel any. Brows are even. You have evenly distributed and full dark eyelashes. The sclera is moist, and there is a little bit of a crease along either side of the eyelid. Next, if you don't mind, I'm just going to use my finger, and I'm going to pull your bottom lid down to check your conjunctiva. Alright, and make sure it's nice and pink and moist, and if you And while I'm doing that, I can also see along the conjunctival right there at the lash line, the puncta, which is just where the tears drain down into the nasolacrimal duct right here, and it's not inflamed. Up here, the lacrimal gland underneath this bone right here. Sometimes it's palpable, but I can't feel it right now. The next thing I'm going to do is I'm going to step over here to the other side, and I'm going to take a look at this conjunctiva over here. Alright, looks good. There's no inflammation. Do you have any tenderness when I touch it? Your blinking's normal. You're not blinking really fast or slowly. Eyes sit symmetrically on the face. Alright, next what I'm going to do is we will do a visual field test. So for a visual field test, you have the Snellen chart or the near vision test. And for the Snellen chart, you're going to stand 20 feet away from the actual chart. And then you're going to read the furthest line down on the bottom that you can. And if somebody wears glasses, you would wear your glasses while doing this and start with both eyes uncovered, then cover one and then the other. And the top number is going to be the distance from the chart, which is 20. And the bottom number is going to be the furthest line that you can read at that distance clearly or normally. And then the near vision test would be where if I were to give Benjamin a card or a book or something to read closely to test to see if he had any visual problems reading something up close rather than far away. Alright, so next we're going to do the accommodation test. And what I want you to do for this is you're going to stare over there at a point on the wall. Just pick a spot, any spot, and just keep staring at it. Okay? And now I want you to look at me. Okay? And what you're supposed to see when you do that is when you pick something that's far off in the distance and then you pick something to go from distance to closer, the pupils will constrict, and yours did slightly constrict. The next thing that I'm going to do is I'm just going to take my light and inspect your iris, your cornea, and the sclera. And like I said, the sclera is nice and moist, and the iris is brown. The cornea is clear. There's no opaqueness. Alright, and now I'm going to do the cover and uncover test. And what I'm going to do with this is I'm going to cover one eye and just look at the other eye that's uncovered, and then I'm going to switch it, okay? And with the cover and uncover test, what you want to watch and see is if the eye that is uncovered has any irregular movements. And there is external meatus, and it's nice and pink and red. The earlobe's detached. It sits where it's supposed to. It's not too high or low on the face. Your ears are symmetrical and even on both sides. Next, we're going to test your hearing, and first we're going to do the Weaver test. I'm just going to hit this on my hand, and I'm going to place it on top of your scalp, and I want you to tell me if you can hear it in the right or left ear or both ears, okay? You ready?
Yes. Both.
Both ears?
Yes.
Okay, good. All right, next we're going to do the Rhine test, and I'm going to place it on your mastoid process behind your ear, and I want you to tell me when it's back there when you can stop hearing it. And then I'm going to place it in front of the ear, and I want you to tell me when you stop hearing it there. Okay? I'm sorry.
All right. Okay.
Okay. So you want air conduction to be greater than bone conduction, which it was. And that just means that you can hear it longer sitting outside of your ear than when it was vibrating through the bone. And of course, you would test both sides to check for hearing loss and to see, which lasted longer. So next, we're going to do the nose examination, and I'm just going to start by inspecting your nose and your nares, and everything looks normal and symmetrical. And if you can, I want you to flex your nares for it. There you go. All right. So the nose is no bumps, no lesions. It's pink. All right. The next thing that I'm going to do is I'm going to get you to smell something for me. And I want you to smell this and tell me what it is, okay? Can you tell?
No.
Okay. Let me get something else. All right, close your eyes for me, and we'll try it again. This one should be a little bit stronger. All right.
Coffee.
Coffee. Good. All right. So, good sense of smell. And next, I'm just going to take a look inside of your nostrils and see, make sure that the internal air is nice and pink and moist, and see. All right, here you go. All right, and there is some hair inside of the nair, and the nasal mucosa is pink and moist. Okay, I'm going to place my hand on top of your head. And I can see both sets of turbinates. Alright, good. So you did have some long black hairs inside of your nose, but there was no exudate or any lesions inside of the nose. Next, I'm going to examine your mouth. And of course, you would do both nares, look on both sides for an actual physical examination. So next, I'm going to look at your mouth. And the lips are pink and moist. They're not dry or flaky. It looks like the bottom lip's a little bit more full than the top lip. Can you smile for me? All right, when you smile, it's symmetrical on both sides. Next, I'm going to look inside of your mouth. All right, tongue's pink and moist. If you'll lift up your tongue for me, I'm going to look at your frenulum. All right, it's pink and intact. All right, lower your tongue down. Open your mouth up and say ah. Ah.
Ah.
All right, you can see the hard and soft palate. And the uvula hanging in the back, it is midline. And I do not see any tonsils, so you must have had your tonsils removed.
Yeah.
Right? Okay.
Right.
All right. Smile for me. Teeth are intact. There's no brown spots. And I'm just going to check your gums, okay? Fill in the occipital lymph nodes on the back of the head. And the lymph nodes should be freely movable, and it's normal if you don't feel any swelling, and there's no swelling there. Then I'm going to feel preauricular. And those are normal too. And post-auricular. And tonsillar. And submandibular underneath the jawline. And submental underneath the chin. Alright, so none of those are swollen. They're all palpable, they all feel good. Next, superficial cervical. And then the posterior cervical. And then the deep cervical. The supraclavicular lymph nodes that are right above the clavicle. Okay, so there's no swelling in any of the lymph nodes there, and then you also have a set of axillary nodes and inguinal nodes. Fine. And feel for lean back just a little bit more. And I'm going to feel for any curvature that may be going to the left or to the right. And everything seems to be nice and medial down the spine, not shifting to the left or the right. There, okay. And while you've been doing that, I've been monitoring your respiratory rate. And your respiratory rate is about 20 per minute. So you're taking 20 breaths per minute. And next what I'm going to do is I am actually going to put my hands at the bottom of your rib cage at about the 10th intercostal space. And what I want you to do, okay, is take a big deep breath in and then let it out for me. So in, out, in, out. One more time, in, out. And I'm just watching here for chest expansion, and while you're breathing in and out, I'm just making sure you're moving symmetrically on both sides, and it seems to me that you are, and that looks good. So next what I'm going to do is place one hand on the side of your back, and I want you to say the word 99 for me.
99.
And again.
99.
And again.
99.
And again.
99.
One more time over here.
99.
And last time.
99.
Alright, what I was doing there is checking for tactile fremitus, just to see if I could feel in the bony prominences of my hand what you were saying, and I could. And this time, everything felt pretty evenly on both sides, but I'm just going to check at the top. I'm not going to go all the way down, but just one last time, say 99 for me.
99.
Alright, even on both sides. And the next thing that I'm going to do is just put my stethoscope on, and I'm going to take a listen to your breathing. I just want you to breathe normally for me, and I may, as I move it, tell you to breathe in or out, okay? Alright, so we're going to start over here at the left side. Take a breath in for me, and out. Alright, in, and out. Alright. And again, in, and out. In, out, in, and out. Alright, so everything seems clear and equal on both sides. I didn't hear any stridor, wheezing, any crackles, so that's good. The next thing that we're going to do is I'm going to listen again, and I want you to say aloud the word 99 for me, okay? Alright?
99. 99.
Okay?
99.
Alright?
99. 99. 99.
Good. Alright, so you're even on both sides. It kind of got a little bit more muffled as I worked my way down the cavity. Next, I want you to say E. Hold it out kind of long for me. And say it each time I move my stethoscope across your back, okay?
E. 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 E.
Alright, good. Even on both sides. Last thing is the whisper test. So what I want you to do is again say 99, but just better whisper this time, okay? And I can feel the bump of the heart. There's no jugular venous distension. Next, I'm going to get you to lie on your left side. And what we're going to do with this is I'm going to palpate the PMI, or the apex of the heart. And there you go. That's fine. And I'm just going to start with the pads of my fingers up here. along the mid-sternal border and go towards the left clavicle. Okay. So there's the apex, and I don't feel any irregular heartbeat, murmurs, or anything like that. Next, I'm just going to take a listen and see if I can hear any thrills or irregular beats. And your heartbeat sounds strong and normal. It's not thready or weak. It's regular. I don't hear any bruits or murmurs. And at the apex, I don't hear any irregular beats. Alright. I'm going to get you to sit up for me. So heartbeat was strong, it was normal, it was regular. The next thing I'm going to do is I'm just going to feel for some of your pulses. I'm going to start with your carotid, and I'm going to start just on the right side, feeling for the right carotid pulse. You don't want to do both sides so that you don't include any blood go to the brain. Alright, and it's nice and strong. And next I'm going to feel for your brachial pulse, so if you lift your arm up, it's in the bend of the arm. And it's strong and normal. And it's regular. There's no irregular beats. And your radial pulse. And it's strong and it's normal. Then you have your inguinal and femoral pulse, and normally you would ask the person for permission to be able to palpate those. Next, I'm going to feel for your popliteal pulse underneath the knee, and I'm going to get you, there you go, to hold it straight out and flex slightly. The popliteal pulse is a little bit harder to feel, but if you know what you're feeling for. Alright, that's strong. Next, I'm going to feel for the dorsalis, dorsalis tibialis pulse along the back of the ankle, close to the Achilles tendon, on the lateral side of the ankle, and it's strong. And next for the pedal pulse on the top of the foot. So first, I'm just going to start by looking over your abdomen and noting any abnormalities. And I don't see any stretch marks, any scars. There's a few more of those small brown macules on your belly. There's never been any change in these, has there?
No.
Okay. The hair is evenly distributed over your abdomen, and there's no protrusion inside of your umbilicus. Alright, so now if it's okay with you, I am going to put my stethoscope on and take a listen to your stomach, okay? It may be kind of cold, and you're going to feel me moving around. If anything gets uncomfortable, just let me know, okay? I'm going to start over here on the right side. Does that feel okay?
Mm-hmm.
I can hear some tinkling in there. What I'm listening for is bowel sounds, so that we know that what you're eating is being moved throughout your belly. and not just sitting there. And it sounds to me like you have some pretty good vowel sounds, but they're not hyperactive. Alright, so right upper quadrant, left lower quadrant, and right lower quadrant have all sounded good. Left upper quadrant, I can hear some tinkling in there. Alright, so that sounded good. And I can see the rise and fall of your chest. Your belly is nice and flat on both sides. And you're going to feel me lightly touch your stomach in several different areas. If it gets tender, just let me know if something hurts, okay?
Okay.
Okay. There's no nodules or masses that I'm feeling. Everything's nice and soft. Does that feel okay?
Mm-hmm.
I'm going to press down here and let up. Feels alright, nothing hurts, no tender. Alright, now take your hands and touch each of your fingers, thumb to finger. Now I want you to take your finger and touch your nose. And touch my finger. Good. Now close your eyes and touch your nose. Good. Now with the other finger, close your eyes. Good. Stand up. We've already tested your gait. So what we're going to do now is I'd like for you to walk in a straight line to about right there, heel to toe. Good. Good balance and coordination. Good. Alright, next what I'd like for you to do is stand on one foot. Alright, good. Now hop in place. Alright, that's good. Alright, now stand on the other foot. Then hop in place. Good. Good. You can have a seat back in. Good. Alright. For the next part of the exam, I want you to tell me, I want you to close your eyes, and I want you to tell me if I'm touching you, soft touch or hard touch, okay?
Soft. Soft. Hard.
Okay. Next, I'm going to put something in your hand, and I'd like for you to tell me what it is. Keep your eyes closed.
Walker.
Good. Next, I'm going to touch you, and I will keep your eyes closed, and I want you to tell me where I'm touching you and how many points I'm touching you.
2. Arm.
Good. Alright. Next, what we're going to do is graphesthesia. What you're going to do is keep your eyes closed, and I'd like to see your palm. Good. And I'm going to draw a number in your hand, and I want you to tell me what number this is, okay?
5.
One more time.
6.
Good. Next, we're going to check your reflexes. So I'm going to start up here with your brachial reflex, and I'd like for you just to hold your arm like that. Alright, and I'm going to grab over here, and I'm going to hit right in the brachial region. Alright, then the triceps reflex, there you go, I'm going to hit right behind here, right behind the elbow, below the triceps. Good. Then I'm going to do the brachioradialis pectoralis reflex, and you're going to go 2 inches above the wrist on the radial bone. Just relax. There you go. You want the forearm to be up. Good. All right. Next, I'm going to do the patellar reflex right below the knee. Good. All right. Next, I'm going to get you to hammer your foot up. And we're going to do the Achilles reflex, which is right behind the ankle. Alright, so next is the plantar reflex. On a grown-up, you would just stroke the bottom of the foot. And you can see his movement there. On an infant, what you would do is just stroke the bottom of the foot, and their toes would spread. Also, the clonus, which is behind the ankle, and you'd hit with the wider part of the reflex handle. Okay, good. And then for the last reflex, we don't have to do it, but it's called the cremastic reflex, and it would be on a small male child, where you would stroke the inner part of the medial thigh, and whichever thigh you stroke, the left side, the left testes would raise. If it were the right side, the right testes would raise. So next, we're going to start testing the cranial nerves. And the first one is the olfactory nerve. So I'm going to get you to close your eyes. And I'm going to put something up underneath your nose, and I'd like for you to tell me what it is.
Coffee.
Okay, good. Coffee was right. The second is the optic nerve. And the optic nerve is your hearing nerve. So that's what we assessed earlier when we did the ear examination. The third cranial nerve is the ocular motor, and it is where you can open and close your eyes, and the pupils constrict. So what I'm going to get you to do is close your eyes. And when you open them, you could go ahead and open them. I saw it. After being in the dark and then open them to the light, the pupils will constrict. So the fourth is the trochlear nerve, and we're going to test it by looking with your eyes. You're going to look down, like to the ground, look down, and then you're going to look towards the inside, like towards your nose, okay, with both eyes. All right, look down at the ground, all right, and then look at your nose. All right, good. All right, so that tested the trochlear nerve. And then the fifth cranial nerve is the trigeminal nerve. And for this one, what I'm going to get you to do is to clench your jaw. So clench your jaw like. Good. All right, so that fifth cranial nerve is good and intact. The next one is the abducens cranial nerve. And for this one, I'm going to get you to, with both of your eyes, I want you to cut. Keep your head looking straight, and I want you to cut looking towards me with your eyes, okay? And then I want you to cut looking towards me with both eyes. Good. So you're looking out laterally. Both eyes going the same direction. The next one is the facial nerve, and for this one you can do, I'm going to get you to smile, okay? Also with this one, what you can do is you can drop something bitter onto the back of the tongue to identify it. And for the next cranial nerve, it is the acoustic nerve, and it is for hearing. And then the next one is the glossopharyngeal, and that's what we would have tested earlier when we got him to stand up and do the Romberg test when he closed his eyes. Remember when we were testing your balance? That's what the glossopharyngeal test. And then the vagus nerve. What we're going to do with that one is I'm going to get you to open your mouth back up, and I'm going to stick this tongue blade in on your mouth, and I want you to say "ah" for me. Okay? I'm sorry. All right. Ah. All right. And when you do that, you're supposed to see the soft palate raise. All right. So very good. The next is the spinal accessory nerve, and for this one, what I'm going to get you to do is just raise your shoulders for me. All right. Good. And then the last one is the hypoglossal nerve, And for this one, I'm going to get you to just stick out your tongue. Alright? So when you stick out your tongue, it looks symmetrical.
Do this, just
for
look
this
up at the ceiling for extension. Good.
And then look down at the ground. Flex your neck. Alright, good. And then rotate left to right. Now, is that as far as you can go on either side?
Yes.
Okay. And then look back to the front. And we're going to abduct away from the center of our body. So go to the right side. And then to the left. Alright, good. Alright. And then the next thing that we're going to do is I'm going to go behind you and just feel the curvature of your spine. And I'm actually just going to get you to turn around real quick so that the camera can see. Okay? And bend over. And I'm going to feel along the curvature of your spine. Feels good. It's nice and straight down. There's no S curvature for any scoliosis or anything like that. Alright, back up. I'm going to get you to have a seat right here. Alright, next what we're going to do is I'm just going to get you to see if you can turn easily to the right side to test range of motion. Alright, to the left side. Alright, good. And I saw you bend down and back up pretty easily earlier. Alright, next what we're going to do is your shoulders. So I'm going to come in front of you and I'm actually going to do some shoulder resistance. What I want you to do is try to lift your shoulders up and then I'm going to push down. So first just lift them up. Okay? Now try to lift my hands up and I'm going to try to push you down. Okay? Alright, good. And then next I want you to grab my hands and I'm going to have to hold on like this. Hold your arms straight out. And I'm going to push against you and I want you to come back at me. Okay, you ready? Alright, good. Good resistance there. Okay, so I'm just going to feel now along the muscles of your shoulder. The deltoids are nice and strong. And back here along the back. Oh, good. Good. Back muscles, trapezius and latissimus muscles. Alright. Nice and strong sternocleidomastoid. Alright, so next for your hips, what we would generally do with that is just knee up, down. I'm not going to ask you to do that. I saw you walk in and have a seat. You didn't have any trouble moving your knees up and down. So next what we're going to do is I'm going to ask you to pick your knee up and I'm going to try to push it down, okay? Ready?